problem with what we're dealing with is we're having kids and adults with little mini car accidents every day, every second. And so if I just palliatively treat the brain, or if I overly stimulate with a methamphetamine, well, most of these kids are already stressed and inflamed. Their brain stem, their amygdala, that fight or flight response in the back of their brain stem is already in overdrive. So putting it more in overdrive does nothing to fix the underlying issue. And so when you look at root cause on one side, palliative on the other side, you can see a lot of times it may help in the short run, but in the long run, it actually makes the problem worse.
Yes. Yes. And probably the best example of that, which is on the rise with adults, is the diagnosis of ADHD. It seems like more and more adults I talk to, they're going into their therapists and or professionals and they're getting diagnosed. And the kicker with this is they're getting medicated. And the problem is going to be, and I kind of put reminders in my phone when I run into these people, because the problem is going to be in about a year, the symptoms are going to get worse. Your child's, if you go back to your child, if your child gets diagnosed, it's almost clockwork. What's going to happen is they're going to get diagnosed, they're going to get medication. Schoolwork might improve over that year, but then after that next year to 18 months, it's going to go back down. It's going to get worse. And then you're going to be on the medical merry-go-round, is most of the situations.
And the issue is if we had patients, we had young kids or even adults that had unlimited amounts of these medications, they're getting treated, they're on every single one of these, you're not fixing the underlying issue, because obviously the people that you're seeing have already gone down this path for many years and they're not happy. They see the symptoms getting worse over time. So, obviously the solution isn't an unlimited amount of these medications being thrown at them. I imagine you're seeing patients that have already gone down this route. What's their general experience? Like, is it like, Dr. Alex, I've gone down this route and I'm exhausted, it's not working? Or have they not even gone down that route, but they want to go down your path first? What's that patient look like?
Unfortunately, it's probably like a lot of your patients, I
Yeah.
assume, and that's unfortunately people have already been down the medical route. They didn't get where they wanted to get, or in some cases they got worse, and they kind of woke up one day, or they finally maybe listened to a loved one or something, and that parent or that person came in and they're like, I am ready to listen to what you have to say and do what you have to offer, because I now understand that what I was doing before was just putting a band-aid on it. And I want to see what we can do to get down to the root cause as much as possible. And it would be so much easier to have those people come in early on, but unfortunately, with how people are getting educated online, or just with how the pharmaceutical industry will put massive amounts of marketing and advertising out, people are going towards the medical route. However, maybe you've experienced this, and something I've noted is in the time of COVID, you can almost say people got a little, quote, red pilled, and we have
Yep.
more and more people coming in. And I do not mean this in a braggadocious way. I do not want to come off arrogant at all, but more and more people are wanting my wife, who I practice with, her
Yep.
and I, to act as their primary care, because they want to listen to what we have to say first. Now, does that mean that we act like a primary care and we give meds and all that? No. In fact, we still say you need to go to your primary care, because there's things that they do and check for that we're not going to, and we don't have the training to. But they will come back to us and they'll say, they're recommending this. What do you recommend? And they're listening to what we have to say first, and considering what we have to say first. And that's very encouraging.
Well, I think a lot of this just started with a massive distrust from conventional medical authorities during COVID. I think people just saying, hey, let's just shut down the schools. Let's just stay inside. Let's not get vitamin D. Let's not get fresh air. And I think we looked at the devastation a year or two later. We have kids that, are years behind, that they may never get back to that literacy rate or that progression rate that they were at school and learning. And then a lot of these kids needed to be with teachers, because that's the only way that they can discover abuse and all kinds of things that are not happening right at home. And I think that all stem from people in the public health and medical institutions not making good decisions, and that broke trust. Also, there's a book out there by Cassie and Callie Means, or Casey Means, and she's a former Stanford doctor. It's called Good Energy. But in that book, there's a couple of stats, and the average child or 13-year-old and less, 70% of their diet's processed food. And the average doctor has no education in nutrition at all. I mean, even at Stanford, zero, very little. Or if they know about it, it's from a disease perspective, right? Oh, beriberi B1 deficiency, or scurvy is vitamin C. They don't know it from a functional nutritional perspective. And so it's very difficult to build healthy brains and bodies and metabolisms when 70% of your diet is processed crap and the average medical doctor has no education in it.
Yeah. Yeah. And I'll still hear people come in and we'll have a child with health issues, immune system dysregulation. It could be ADHD. It can be just name it. And they'll come in and unfortunately they'll say, well, the pediatrician says that diet doesn't matter. And then you start talking about, okay, why would they say that? And sometimes that's purely that's not in their training, because their job is to see a problem, diagnose, and then treat. And the treatment is usually medication. So if it's outside of that realm, that's out of their black and white. Everything else is gray, it's unknown, or it is unapplicable. And that's pretty much the mindset of a medical doctor. And that's why some people are getting turned off by that, and they're seeking other means to get their health needs if they can't figure it out on their own.
100%. And I don't think it's, any big conspiracy, like your doctor has all this information and is withholding it from you. And there's like, I picture like a guy with a top hat and a monocle in a smoke-filled room, right, with cigars. Like it's not that, right,
No.
corrupt. I think it just comes down to the average doctor lives 10 years less than the average patient. So it's not like these doctors have all this information and they're just withholding it from you. Their education is drugs and surgery. They're primarily founded by big food, big agri, and big pharma, right? And then if you go look at how that happened, I mean, you can go back to the Abraham Flexner Report, 1910, paid for by the Carnegie Endowment, that took medical schools in the direction of pharmaceutical and surgical care, moving away from chiropractic, naturopath, homeopathy. That's kind of where we had a much more broader medical institution 100 years ago, and it's gotten way more specialized. And it started there. And if you go read Good Energy, they kind of talk about where that started and how it's gotten to be where it is. And so then the average doctor, their curriculum and their education is this. But the problem is there's a lot of hubris and arrogance behind it, that if that doctor thinks, hey, if it was important, I would have been taught it at Harvard or Stanford. The problem is it's not true, right? Because the powers to be and what created that curriculum for you put that information in this track here. But all of this stuff that we're talking about, nutrition-wise, functional neurology-wise, is over here.
Yeah.
And so I think that's really the difference, is just that the curriculum is very limited. I mean, for instance, the American Diabetic Association makes no specific recommendations of carbohydrates and sugar in diet to diabetics, when we know diabetes is a disease of high blood sugar. I mean, that's kind of where we're at with nutrition. It's crazy.
Unbelievable.
Yeah. Unbelievable.
I tell my patients that all the time. And there is a neuropathy clinic 2 doors down from us. And it is a tragedy seeing these people try to even walk. And there's nothing changing with their health. It's mind blowing, absolutely mind blowing.
So I brought both my kids to see you, and I know you did a very, very specific kind of unique workup. I like to always compare and contrast, right? Someone goes to see their pediatrician or they go to see a neurologist, right? They're a mom or a dad that has a kid who's 5 or 6 or 7. They know there's some brain issues, some learning issues. Just kind of compare and contrast for a few minutes. What does your assessment look like? And then compare it to the general pediatrician or pediatric neurologist workup.
So to be as brief as I can, it usually starts with consultation. We want to get the parents on the phone or in the office. If the child comes too, that's great. Get to know them just like we did with you guys. Then make sure it's a fit. We want to make sure parents are comfortable, make sure we're comfortable, make sure we think we can help you. Then after that, we send you home with a chunk of paperwork and get to know the child on paper. And then as long as everything lines up and there's no what's called contradictions to care, then we're going to have you come in for the exam. The exam can be anywhere from it can be more, 1 hour, 2 hours, 3 hours. Today I did, took me 2 hours to get through an exam on this 18-year-old girl with autism. And when they come in for the exam, development it's going to be more development related. So I'm going to be looking at what's called retained primitive reflexes. If those are present, then the next stage of development, core strength, gross motor skills, and in general muscle tone is going to be down. It's going to be low. We're going to have issues. If that's going to have issues, then the next thing that needs to develop, which is generally speaking sensory processing, including your vestibular system, which is your brain's awareness where your head is in space, your proprioceptive system, your brain's awareness where your body is in space, and your vagal system, which is your brain's awareness of what's going on inside and amongst other things, then that's going to have issues. Then the next thing is fine motor skills, then and ocular motor control included in that. Then on top of all that, we have at the top of a tree, if you will, is going to be our cognitive, social, emotional, and physical traits. And we all want to see those 4 big topics in our kids be great. We want them to be socially with it. We want them to be emotionally with it as well. We want them to be Patrick Mahomes. Physically, we want them to also just be great humans. And if that's not enough to ask, if you have all of that stuff going on under the hood, then we're going to have problems. So depending on the child, Dr. Lauren and I will assess, depending on the age, it could take 50 points of data and observation up to 300 or more. And it takes hours. And then we go over the results and lay it out. And as long as it makes sense and everyone wants to move forward, then we start